over at the Yanadassis. DEA agent Gomez from Breaking Bad, Stephen Michael Cazeta, will be in town. And it's all sponsored by arthritis specialist. Dr. Marty Morell is in studio here this morning. Good morning, doctor.
Good morning.
I have to have you get really tight to that microphone, but not so tight that you catch the cold that somebody previously, you know what I'm talking about.
Nobody had a cold.
Nobody did. We're so paranoid about that around here.
You should.
You have to be.
Yeah.
So fibromyalgia. You know, my wife has fibromyalgia along with Sjogren's syndrome. So she has a copy of this, which, by the way, is an easy order if you go to Amazon.com. So talk about fibromyalgia. And for people that don't know what it is, which is most people, unless you have it, and even then it's hard to put your finger on what it is. But I'll give you an example. My wife, if you touch her when she's having an episode, I kind of feel like she feels that way about me always. However, literally putting blankets on her body hurts. That's unbelievable.
It is, and even the people that take care of this condition don't understand
Right.
it very well, and that was part of my research over the past 10 years, looking into every part of the disease itself, and one day it hit like a light bulb. I was able to put the pieces like a jig puzzle, if you will, and the book is basically the story of what this is, and in reality it's a neurological disorder which lives, if you will, the epicenter is in the spinal cord. Yeah. The nerve cells just change and are very hyperactive and very sensitive. So when you grab somebody on an extremity, for example, that electrical signal reaches the spine, and when it reaches the spine, it gets amplified to the brain. It's really painful.
Yeah. And it is not always just pain, right? And I'm not sure if these all go together. But with fibromyalgia, you can have the restless leg syndrome. There are other things that go along with this. Is that true?
Directly and indirectly.
Okay.
There is a lot of sleep disorders associated with the fibro. If you look at the brain itself, that chronic pain signal that's been bombarding the brain over years will make physiological changes in your brain. And if you look at a functional MRI part of the hypothalamus, for example, it will shrink by 7%. And what lives in the hypothalamus, among other things, are sleeping centers, ability to stay awake, concentration, short-term memory. So when you look at this disease, the spectrum is so wide.
Right.
One of them is leg or movement disorders at night, yes.
Right. And how is there a tie with things? By the way, if anybody has any questions about fibromyalgia, we've got a few minutes with Dr. Martin Morell. It might be worthy of a phone call, 315-736-0186. The book is available, Fibromyalgia Unification Theory, Connecting the Dots. Martin Morell, Morell. It's available on Amazon. And then your office is in New Hartford. But my wife, of course, with Sjogren's. Almost everybody that has Sjogren's syndrome oftentimes ends up with fibromyalgia as well, but
not necessarily.
Not the case.
As a rheumatologist, we see up to 144 diseases. Some of them are very common, like
lupus could be a
rheumatoid
part of it?
arthritis. Lupus is less common, but it's there. For fibromyalgia, it's about 6-7% of the population.
Wow.
So it's a very big number.
Yeah.
Psoriatic arthritis, gout, and vasculitis. But no, so Sjogren's is an autoimmune causing inflammation of the glands that produce saliva and tear, and we have treatments for that.
Well, she does this thing with, and it's interesting, she does this thing with vitamin, which vitamin injection she gets? Is it
B12.
Is it B12,
yeah.
yeah. So, but you don't believe that really makes that much of a...
B12 should be indicated when you have a macrocytosis or an anemia that requires B12 because of deficiency.
Yeah.
People that have had a gastric bypass or weight loss surgery might be at risk. Or excessive bleeding sometime, although that will be more iron deficiency. So you have to look at the deficiency to put the vitamin in there. If not, it's not going to do anything to a neurological disorder that lives in the spinal cord.
So you're suffering from fibromyalgia, and so we can't see. You look perfectly fine. And I don't know what we used to do with people that had fibromyalgia years ago. Probably just thought it was all in your head, and technically, is it in your head?
Well,
I mean, it's neurological. So
there's a lot of comorbidity with depression, and part of it is associated with that. Nobody knows it. You look good from the outside,
right?
But in the inside, you feel like you can't move. You don't have any energy when you wake up.
Yeah, she'll say, I just feel like I didn't even sleep. Didn't you wake up? You did not even felt like I slept the whole night.
If you were to study their sleeping patterns, the REM is affected. So you have to. One of the treatments that we do is to try to achieve REM, and there's some medications that can help with that.
So, when you say there's treatment, I'm assuming this is complex because the disease itself, is it the disease, by the way?
Yes.
The disease itself is extremely complex, and you talk about how many different variations. So how do you treat that?
There's no cure, just like osteoarthritis or scleroderma. The other diseases that I suggested, we have some things that we can do, okay? But in the book, I break it out in 3 areas: sleep, daytime pain control, and finally, boosting energy and concentration ability, especially for those that are working full-time and can't function because they're getting tired. There's ways of improving energy and concentration.
All right. If people have a curiosity and a worry and a thought of this, maybe they're suffering from it or there's a family member is, the book does what? What does getting the book do for you?
Basically, it gives you the belief that it's really a disorder.
Right. Which that's important because there are people, physicians, that don't recognize this as something that is real.
They don't respect it. They say, oh, it's all in your mind. I don't want to deal with it. They never took the time to look into it. And that was one of the challenges that I had. Wow, this seems real. I got people here that have good bank accounts. They're doing very well, and they have this severe condition. They can't function properly. I got to find out what is this all about. And that's 10 years later, that's where we are now. All
right. Again, the book is Fibromyalgia, Unification Theory, Connecting the Dots. Do you find it's a strategy that you have to, so you come up with a game plan? It's not cookie cutter, one size fits all. How do you do that?
No, because, on the spectrum, you can get gastric symptoms like irritable bowel, or you can get paresthesias, numbness in the extremities. A lot of these people go through nerve conduction tests, and, hey, the tests are normal. It's not there. The problem is in the cerebral cortex, on the area that corresponds to that extremity. It's explained in the book. So you have to be aware. And also be aware there are things that look like fibro that are not fibro. Side effects from cholesterol medications, polymyalgia rheumatica, vitamin D deficiency when it becomes severe, gluten sensitivity, and the list goes on. And we have to look for those before we label something fibro.
I'll give you one example of what my wife has been, her story. We would be driving down the road, and she would get an itching attack. Can that be tied to fibromyalgia, or is that something completely different?
Probably different. Dry skin. What the fibro does is amplify any signal that you have. So if you feel itch, you're going to feel more itch.
More
if
itch.
You feel
to the
pain,
point where I almost thought she was going to jump out of the car. It was so bad because you can't imagine just having the most intense itching you've ever had in your life that doesn't go away. It's amazing how complex this is. And you have a facility that helps.
We hope so.
Okay. How do people reach out to you, by the way, at Arthritis Specialist?
Well, in fact, we see patients relatively early compared to other practices in upstate New York. We're on the phone book and the internet. It's easy to get us.
All right. And the book, of course, is available on Amazon.com all over. Fibromyalgia, Unification Theory, Connecting the Dots by Dr. Martin Morell. Thank you so much.
Thank you.
And thank you for helping us tomorrow night.
Our pleasure.
The goal is, they're about $15,000 shy right now. We're going to work to eliminate that gap.
Well, I hope that
this
humble investment in you will help catalyst people coming in and organizations to try to help the kids.
We appreciate it. Thanks so much. Marty Morell.